Mr. Xie, Amy, and Nina, and dear colleagues all over the world, good afternoon. And it's my great pleasure to share the experience of VeriSee DR in Changhua Christian Hospital. Can you see the slide? Sorry. And I'm Shih-Te Tu. I'm an endocrinologist and a diabetologist. As we know, there's an old saying that the good healer cures the illness that is about to break out. So when the physician, when the diabetologist faces a patient with diabetes, he faces a seven-head monster. Why? Because he needed to survey if any micro complication or other macrovascular complication. And when he aged over 65 years old, he needed to survey the patient is any osteoporosis because the patient is high risk group for osteoporosis. He also needed to choose the right medication for diabetes, hypertension, hypercholesterolemia, even urge them to smoking cessation. So when a physician faces a diabetic patient, he has limited time. How we can survey the patient's microvascular complication in an efficient way? There was two ways to do the job. The first one is teamwork. The second one is the pathway standardization. So in Changhua Christian Hospital, we have more than 10 certified specialists. They are all certified diabetes educators. Also, we have certified diabetes educators, and we have 3 certified registered dietitians. They was also a certified diabetes educator. Also, we have a large room for case management center. It's a EM center. So in the space, we can have patient enrollment assessment. And we want to provide a one-stop service for our DM patient. So all kinds of complication survey was done in this space. And we teach them how to self-management education, including nutrition counseling, medication counseling, and lifestyle modification. So this is our photo of the case management center. As we know from the speech from Professor Xie, diabetic eye disease is a much feared complication of diabetes, and it consisting predominantly of diabetic retinopathy, diabetic macular edema, cataract, and glaucoma. And if we can early diagnosis and a timely treatment, then we can prevent the patient vision impairment and blindness. So it is very important for our diabetes management. So at Changhua Christian Hospital, we have according to consistent with the program guideline, we have a lot of mandatory diagnostic tests for each DM patient. And this was ordered as a packaging upon enrollment. And and this is very important, is we have a machine for retinal photography by our technician to do the job for our DM patient. And we also have some information system for us to refer the patient to ophthalmologist by single click. We can make a reservation for the OPD visit. So this is the original patient drawing at CCH. The patient, when they come to our OPD, then we assign them to do the ER screening. Then our educator or our technician will take color fundus image for patient. As you know, like Professor Xie said, the ophthalmologist do not want to interpret this simple fundus image. So the job was dependent on our endocrinologist to interpret the image and science diagnosis report. After we finish the report, if any abnormality find, then we will refer them to ophthalmologist for treatment. This is our original patient journey. But they have some pain point during our previous patient journey. The first one is per month, we have over 1,500 patients needed to refer us to do the retinopathy screening. So it's a huge reading. The second one, as you know, the photography was taken by our educator or even our technician. So there is no image quality check during the large work loading. And like the saying of Professor Xie, we are internal internists. So we are not trained by special eye training. So DM doctor was not eye specialist. So per day, we needed to finish 45 reports per day. And this was divided to our more than 10 endocrinologists. So some is young, some was very experienced. So it's harder to complete the job in the same day appointment. So when we needed some delay in the report system, so we will refer to the ophthalmologist who are in a delay pattern. So delay refer and delay treatment. And as you know, ophthalmologist is very busy. There is very difficult to have an OPD to have a registration. So we delay the patient for his treatment. Now, after we implementation of VeriSee DR, they can ensure the quality of image because it was done by the AI. The second one, it provides a better care and the convenience for our patient. And due to the report was finished by our endocrinologist, so now we have AI support, so we can add confidence and accelerate the diagnosis. Then we design a system we will talk about later, why we can provide early treatment cooperation with our ophthalmologist. Maybe the next presentation by Amy, they will talk more about how to integrate in VeriSee DR with his or PEX. But as I know, due to Acer have a cooperation plan with Changhua Christian Hospital, they can customize. Even they can produce the automatic report, send via email, or use other file format or other needs or requests during the hospital and the company. So I will make short introduction in that. And after we use the VeriSee DR, you can see when we take the photo from the patient retina, the PEX upload the image, and the AI can automatically display a VeriSee DR result. Then they will get to the first one is the quality of the image. So it's good or bad. So the photo quality was adjusted, analyzed by the AI. We just click the button of the AI button, then he automatically produce the result, and then he interpret that is the patient right eye have no apparent diabetic retinopathy, or the left eye have mild non-proliferative diabetic retinopathy. Then they will automatically have suggestion, refer or non-refer. As an endocrinologist, we just click the button, generate, then the result automatically produced, and we finish our job in interpreting the photograph of retina. And someone were curious about the result from adjustment analysis by physician or just by the AI. This is the result from 2020 November to 2021 January. we have 35 work days. We have analysis about 1,595 patients and random select 299 cases for analysis. And you can see they have good agreement, over 90% between the team of DN, doctor at CCH and the VeriSee DR. And this is a very high level agreement. And we can reduce the time it takes DN doctor to interpret a fundus image. As I presented earlier, we just click the button and the report will produce in seconds. Then we just compare the photograph from the PET, then to decide, make the agreement with the machine or just by our adjustment. But you know that 91% is totally agreement. And so we can accelerate the diagnosis process. And some physicians were curious about the 9%, which was not in agreement. So we make the analysis of the agreement, and then we found that over 66%, there was no diabetic retinopathy or mild NPDR. Why? Because 66% non-agreement because our patient is old. More than maybe 50%, their age is over 65 years old. And some have cataract and some cannot dilate their pupil. So they have some disagreement between our physician adjustment and the AI. So, but the result was between no DR or mild NPDR. And this was actually set up as non-refer. So it didn't influence the result. We want to refer the patient to ophthalmologist. And the 30% disagreement between non-DR, reasonable and unable to analyze. As I say, some patients due to cannot dilate their pupil or they have cataract, so they cannot make analysis. So this is bad image quality. And only 10% was other disagreement. As I mentioned previously, the implementation time will shorten. When we have no AI, we will delay the job because we are very busy. So when I needed to make the report, we always delay. So maybe 1 month or 2 months, we just finish the report process. And every time when we see the photography, we needed to take 5 minutes to see how is the abnormality and make the report. But after we use the AI, they increase our confidence. So less than 1 minute, we can accumulate the report for the patient. So it has 80% decreased the interpretation time. And after we use the AI, we have a dedicated DR click. We cooperation with our department of ophthalmologists. So our ophthalmologists who are major in retinopathy, they assign a everyday click from the morning to afternoon. So they can access our green channel for us to do the same day refer accept. As we know before, we finish the report in delay process, so maybe weeks or months. Then we refer to the ophthalmologist, but their OPD is always busy, and we can reduce them to them. We cannot refer them to them in the right time, so some patient will visit NTUH Professor said because he had other routes for earlier visit. But after we implementation the AI, we can analyze the report in the same day. And we use the green channel for the CCH DR clinical ophthalmology in a very quick time interval. And the patient can access to the right treatment in days. This is our information system. We have a special registration clinic for them because diabetic retinopathy OPD. So we choose it, then we assign the patient without the name of the physician. It's just OPD. Then which time you want the patient visit the DR clinic, you can choose. Then we have 6 ophthalmologists who is a specialist for the diabetic retinopathy. In Monday to Saturday, in the afternoon or morning, they provide a special OPD for our referred diabetic retinopathy patient. As you know, we have a lot of patients with maculopathy because there is a special disease for old age group or DM patient. And after this patient referred to DR clinic, they make a comprehensive eye examination before they have a face-to-face consultation with our ophthalmologist. They do the visual acuity, they check the intraocular pressure, they have an optical coherence tomography, and they use an ultra-wide field photography again. For the fundus, as you know, our machine is not ultra-wide field, so some lesion will under-diagnosis, but when we refer to the ophthalmologist, they use ultra-wide field photography for the patient, and they do the pupil dilatation. So after this comprehensive eye examination, our ophthalmologist can have a good diagnosis and make a good treatment plan for our diabetic patient. So after we use the VeriSee DR, you can see our patient journey have some change. The first one is image quality check system, ensure fundus image are readable by doctors. The second one, it increase the confidence of DM doctors in diagnosing disease. When we have the diagnosis, our back have some Professor Shea. He told us this is right or this is wrong, this should be referred or this should not be referred. We have automatically Professor Shea as our support for diagnosis. And then we can only take less than 1 minute, 60 to 80% faster than before. And so we can have more time for our patient to increase the screening rate, and we have better quality of care for each patient. And the DM patient also satisfied because they can right away refer to ophthalmologist in a timely fashion. So early treatment to prevent the vision loss, even blindness. Last of all, I will make a summary of the impacts after the implantation of VeriSee DR in Changhua Christian Hospital. From doctors and healthcare professionals, DM doctor increased confidence. We can interpret image faster, less than 1 minute, and then we have more time for patient. For the ophthalmologists at Changhua Christian Hospital, they have more efficient and dedicated DR clinic that provide treatment faster. And then from other healthcare professionals like other internists, they can also have better efficiency and convenience to do the retinopathy screen for their patient and the treatment. For the hospital, we can increase the DR screen rate. We can retain the DR patient within CCH because after the cooperation with ophthalmologists, they can be sure to stay at Changhua Christian Hospital for the treatment for their DM retinopathy or even maculopathy. So they have better patient outcome. For the patient, increased convenience and receive DR treatment faster. So they have better quality of care. To our society of Taiwan, I think after the efficiency screening system and the right treatment for our DM patient, they have better disease management, and we can prevent blindness and decrease the society burden. So this is my presentation. Thank you for your attention. This is the photo of our team. Thank you.